My name is Angella MacEwen, and I am the senior economist for the Canadian Union of Public Employees, and I'm also the chair of the Trade Justice Network.
Wonderful. Thank you so much, Angela. So I guess I want to start off by asking, in Montreal, I've been reading that Canada wants to open a Novavax manufacturing facility here, as well as there's a possibility that Moderna may also open up a facility here. Do you think that it's good for Canadians to have our own, vaccine manufacturing facilities? And I guess what are your thoughts on it being Novavax and Moderna?
Yeah, that's a fantastic question. So we do support Canada having those manufacturing capabilities, and we used to in the past have more of that, but it was publicly owned. So through the University of Toronto, they owned now I can't remember the name, but also through the National Research Council. So there's still some research being done at the National Research Council in Winnipeg, but we're very famously will do the research. We did the research for Ebola, for example, and then we sold the patent and didn't use that knowledge or that publicly funded research to create a more affordable vaccine for people. We actually instead we sold it to somebody who wanted to make a profit from it. So our perspective in terms of global justice and in terms of Canada playing a role in that is that vaccines are something that really should be publicly funded. Moderna was publicly funded to a large part. A lot of this research came from publicly funded research for the COVID-19 vaccines. And so it's really disappointing to see now profits taking over in terms of, and this is one of the reasons that we're speaking out about this on May Day. We think there's a global solidarity problem here where we're prioritizing the profits of big pharma over equality of access to the vaccine. And so if the vaccine is truly a public good, if it's the research and the funding and the manufacturing is publicly owned, then you don't have that problem where profits get in the way of making sure that everybody has access to the vaccine.
So with Moderna specifically, could you, I'm sure maybe entails a large explanation, but as much as you can say, how does Moderna go from, being a company that was publicly funded to making profits, I guess, specifically in terms of the COVID-19 pandemic?
Right. So it's really a philosophy, I think, on the part of the Canadian government and the American government right now, where they see the role of public research as helping innovators get off the ground, whereas what we maybe did in the past is we saw the point of vaccine research as being a public good. And so it's not just coming up with the research, it's also making sure that people have access to affordable vaccines. So it was intentional, I think, in the philosophy and the way the American government rolled it out. The research for the mRNA vaccine, the research for like that has been going on for years before COVID-19, that was all at publicly funded institutions. Those scientists, have full-time jobs where this is what they're looking into. Because you can't guarantee a profit in this area, it's more likely that the public sector is going to have an interest in doing that research, which absolutely makes sense. And so then when there's an opportunity for profit, the philosophy of the Canadian and American government right now is that you kind of spin that out to a private enterprise and let the profit motive help allocate resources, which is what we saw happen here.
Could you explain the notion a bit more of a people's vaccine and why do we need this?
Yeah, so we've seen Pfizer and Moderna over the past year make billions of dollars of profit, and rich countries have scooped up most of the supply of the vaccine for themselves. And there's over 2.7 billion people who have yet to get their first dose. Yet many of us in Canada, if you wanted, you could have your third dose by now. Some people are getting their fourth dose who are high risk. And so it's just so unequal. And so one of the proposals that came out very early in the pandemic, it was in October of 2021 from India and South Africa, was that there's a global treaty that governs intellectual property rights at the World Trade Organization. And it has a clause in it that says, look, in cases of emergency, we can suspend some of these property rights. We can encourage companies to share information if it's an emergency. And the idea behind it, I think it came around the AIDS crisis. And it's never fully been used. But India and South Africa said, hey, why don't we use this now if there's ever been a global crisis where we need to make sure that the world gets vaccinated? It's now. So let's suspend these intellectual property rights. Let's ensure that for treatment, for testing, for vaccines. I mean, we were having countries, Italy was making its own ventilators because they couldn't produce them, and they started getting sued by the companies that made them. Yeah. So we were doing these things to save people's lives, and profit kind of reared its ugly head. And so it seemed like a moment where we might actually do this. But Canada, originally the US, and the EU have been dragging their feet on agreeing to make this happen. Canada and other countries also have domestic legislation. So in Canada, it's called the Access to Medicines regime, which allows us to do that domestically so that domestic companies could manufacture and export. We've been trying to get the federal government to do that as well. They have not agreed. They've not said, no, it's a terrible idea, but they're really slow and dragging their feet, and they're not telling us how we make it happen. So we've said, can we get this? There's all these technical pieces, and we're trying to get them to do it. We've been lobbying them for, again, over a year on this. There's a company called BioLease that has an agreement with Bolivia. They will manufacture and export to Bolivia, but the federal government isn't doing what it needs to do to allow that to happen. So both domestically and at the World Trade Organization, the Canadian government is playing a delaying role in making sure that we can actually produce vaccines. And there's the capacity there. There's the capacity in South Africa and India they manufacture a lot of our flu vaccines already. So the know-how and the capacity is there. They just need the allowance to be able to do it without getting sued by Pfizer and Moderna.
Is the root of governments being slow wanting to have priority over these vaccines?
So the Canadian government and the American government and the EU are being very heavily lobbied by pharma. So I think it was at first not wanting to upset these big companies when we needed to get some ourselves, because Canada is in a unique situation where we're not really producing anything in the supply chain for these vaccines. So we don't really have anything to bargain with. And so, yeah, the Pfizer and Moderna could have said, yeah, we're not going to give you any. You're going to go to the bottom of the list if you take this position. But it's also, they just are very powerful in terms of, and influential in terms of their lobbying. And as important as this seems, it's a global action problem. So they can always kind of say to themselves, well, we're not the only ones dragging our feet, so it's not our fault per se. But it would be really nice to see the Canadian government provide some leadership on this.
Thank you. Seeing as especially I kind of see the UK as what's about to happen in Canada, just in terms of what variants they have. We always get it next. for Canada, or yeah, I guess I'll say Canada, for Canada to kind of, sorry, I'm going to rephrase this, for the pandemic to maybe become an endemic, or finally be over, is it absolutely essential that all countries have access to this vaccine?
Yeah, that's our position, is that one of the ways to save lives globally is to make sure that everybody's vaccinated so that there are fewer variants, so that there isn't this constant cycling um, through. I think, masking and improving ventilation and all having sick days, all of that helps as well. And so we've added that to our list, but we definitely think that it's obviously not going away if you can't get everybody at least vaccinated. And there's definitely more problems than just the production of the vaccine, um, certainly, but that's a big one, right? You can't do it if you don't have affordable um, and accessible vaccines.
Thank you. And I know we're here to speak about vaccines specifically, and access to vaccines. But I'm just curious, do you have any thoughts on maybe the management by the city of Montreal, or the Quebec government, just in regards to maybe not specific, like the rollout of vaccines, yes, but maybe the education towards vaccines, just considering we have many anti-vaxxers in our society?
Yeah, I think that there was a intense pressure to get people vaccinated, and governments were relying across Canada, not just the Quebec government, but governments were relying on that social pressure to get people vaccinated instead of taking the time and having conversations with people. So they there were actions that were clearly designed to make it uncomfortable for people to not be vaccinated, right? Like you couldn't go to the restaurant, you couldn't. And yes, there's some health justifications for that, but in large part um, it was to apply pressure to get people to get vaccinated. And so that has, I think, had a very negative outcome. There are smaller communities like Jane and Finch in Toronto where community workers did a whole bunch of outreach. Racialized people are one of the biggest groups, and immigrant communities to be hesitant to get vaccinated because they've had bad experiences with the healthcare system, and they don't necessarily trust that it's going to be safe for them. So there was a targeted community outreach that really helped to get vaccination rates up in that community. So that type of approach, where communities are hesitant for different reasons and for valid reasons, it's definitely proven to be more useful than just the social pressure approach, which really made people feel isolated at a time when we were already so isolated from each other from the lockdowns. So it just kind of, I think, was too much for people to really be able to process.
Thank you so much. And just on that note, I also want to ask, considering what you said before about how you've added the importance of sick days, ventilation, things like this, do you think, the Quebec, Montreal government, but also federal government, do you think that the budget cuts, notably by the Ontario and Quebec government, do you think that this really increases inequality in our society, especially, to, how do I say this? um, just keep everyone safe from the pandemic?
Yeah, we've seen provinces across Canada, again, some are better than others. Like Nova Scotia has been putting more money into healthcare workers and attracting healthcare workers, training them, increasing their pay so that they can retain them. But other provinces, like Manitoba and Ontario, have been cutting the salaries of healthcare workers. And they're getting 1% wage increases now at a time when inflation is 6 or 7%. Um, And so that's really hard for someone that has, you know, is burnt out working so hard throughout the pandemic, has seen their government implementing policies that don't necessarily make sense or hard to understand, that really don't seem to be helping them, and then also cutting their wages. And so we're having I think what we had really hoped at the beginning of the pandemic was that governments would see the need to reinvest into the healthcare system and understand the cracks in the healthcare system. And we haven't really seen, the federal government has come forward with some money, but we haven't really seen the provinces take them up on it and push that a little bit further. So we are hearing a lot of concerns about privatizing healthcare because of the additional strain. So we know that there are tons of issues in terms of surgery backlogs and tests and all of that. And so in my day job at QP, I am concerned about those pressures on the healthcare system and making sure that we properly fund a healthy and stable system.
Do you think that ultimately the pandemic has, in general, just given more push towards privatization?
Well, I think at this point, that's what we're seeing. Yeah. Yeah,
And
because of the backlogs and because people who have money want to be able to pay to jump the line, and because provinces haven't put the money into especially recruitment and retention of healthcare workers, um, that we need to do this work. When you're talking about how many beds you have available, often the constraint isn't beds. Or if you're talking about delays in testing, often the constraint isn't, the machines for testing. It's actually the technicians, it's the healthcare workers, it's the nurses. So, yeah, when we're talking about not having the capacity, it's mostly a workforce capacity, and that's something they can fix.
I know this is a pretty straightforward question, but ultimately, if we do move towards privatization, will it the divide between who gets to have healthcare and, you know, survive really difficult cases of COVID be, who has money and who doesn't?
Exactly. That's the type of thing that you see in the United States. So if you have coverage through your work, then, or if you can afford to pay it out yourself, you can get better treatment than somebody who's going through the public system. And that's ultimately the concern, that then results in a much lower quality of care for the majority of people. And it becomes more expensive, actually, because when you have that two-tier system, it drives up prices. The profit motive um, in the private part, because often the people who have a lot of money have a lot of money, and so they can pay kind of top dollar, and so that drives up prices. We see that for drugs and all of medicines in the States, and so it's a huge problem that we're quite concerned about. And we've seen provinces slowly moving there, like Saskatchewan has been allowing private MRIs, and BC's talking about allowing other types of private clinics. But at the same time, we saw a large number of people recognize the need for public long-term care facilities through the pandemic. A lot of people, I think, maybe hadn't realized that long-term care isn't a part of healthcare. And so in many provinces, a large number of long-term care facilities are privately run. And their outcomes were far worse in COVID-19. Again, because if you're trying to make a profit, you have fewer staff, you have fewer of the precautions. But if you're running on a not-for-profit or a public model, you tend to have better staffing and better standards of care. So we saw that the outcomes were much better. And so we are seeing a big push to moving long-term care into healthcare, into making sure that it's public and it's covered for everyone. So I think that overall Canadians are very protective of healthcare, and that will rise to the challenge to defend it. But we are seeing these pressures, and we're seeing governments, provincial governments, and business interests trying to kind of wedge in there.
Thank you so much.
Yeah.
I just want to ask, what can regular Canadians do to, push against the privatization of our healthcare system and also push for access to vaccines for all? I know that's a large
Sure.
ask.
For the vaccines, the Trade Justice Network has up on our website a letter that you can write to members of Parliament, and it has some explanation there if you want a little bit more background on what the history has been of the evolving story over the past year and a half. And then it has a letter that you can modify if you want. You put your postal code in, and it will send it to your member of parliament as well as the ministers for affected agencies. And that's at tradejustice.ca. When you go there, you'll see that. We also have on our website, we have a National Day of Action on May 1st, International Workers' Day. So you can see about our organizing call. We're going out to May Day events, and we're handing out leaflets with that information. For healthcare, in most provinces, there are organizations like Medicare, Canadians for Medicare, that do work around ensuring, following what's happening, and ensuring that that we can push back on it. And there's also an organization called Doctors for Medicare that does really good work around protecting the healthcare system. And then at CUPE on our website, we always have lots of stuff about how to defend our public healthcare system.
Amazing. Thank you so much. Is there
Thank you.
anything that I didn't ask that you want to share or you think is important to look into more when pursuing this story?
No, I think that's great. I really, yeah, I think it's really important to see how we fit into the global story, right? Like looking at our own healthcare system is not separated from making sure that everybody can get vaccinated, and looking at how um, at medicines, how we do research and how we manufacture medicines is that's so important, because if that's for profit, it makes it more expensive for us to have universal health care. And we've also seen the federal government dragging their feet on implementing pharmacare. Again, we think it's because the pharmaceutical companies are pushing them and saying, you know, maybe maybe you won't get as many doses as you wanted if you start, you know, reducing our prices or trying to crack down on some of this profiteering. So being able to produce our own medicines, I think, is a really important piece of that study. And I know the Quebec kind of has its own formulary and has a different way of doing things, that I think is probably better than the rest of Canada. But those are that idea around how all of the pieces of that supply chain are really important. If you're letting people profiteer off of the medicines, then it gets more expensive to provide the healthcare.